Hello everyone, it's a beautiful, blessed new day, and I have the privilege to welcome you back to your favorite YouTube channel that deals with all nursing knowledge, the Nursing Student Channel. If you happen to be new here, kindly hit that subscribe button and then hit that notification bell so that you get all the new videos that we post here. And if you're an old member, welcome and enjoy the class. As we ended the last time in the last video, we ended with the nursing diagnosis completely. We started with the nursing diagnosis because we're going to talk about the care plan, and the one part of the care plan that needs more time on is the nursing diagnosis. That is why I used the time to go through that first. So today our topic, we're starting a fresh topic, and the fresh topic is the nursing care plan. That is basically what nursing is all about. It talks about what the nurse is doing for the patient, wants to do for the patient, has done for the patient, is planning to do for the patient, and everything that the nurse intends to do for the patient. So the nursing care plan is just like you telling us, that's you the nurse telling us, telling everybody what you have in mind to do for the patient in order to help the patient with his or her condition, to bring the patient back to optimal health. So the nursing care plan is basically what nursing is about. Now, what is the nursing care plan? We've done a quick introduction, but then what is the nursing care plan? How should I explain the nursing care plan to my colleague or my student or whoever is interested in asking me? Now, the nursing care plan is defined as a formal process that correctly identifies existing needs and then also recognize potential needs or risks of the patient that is to be worked on by the nurse. Okay, so a formal process that correctly identifies existing needs as actual problems and then recognizes the potential needs or potential risks, that's potential problems and risks of the patient that the nurse is supposed to work on. That is basically the nursing care plan. So the nursing care plan doesn't only focus on the actual or existing problems the patient is going through, but then also focuses on the potential problems or the risk problems that the patient can encounter. Are you getting it? So from our nursing diagnosis explanations, we know what potential problems are, we know what actual problems are. So we're not going to go deep there, but then just understand that the nursing care plan doesn't only focus on actual problems, but then it also focuses on the potential problems or risk factors. Okay, and then for the nursing care plan, it begins the moment the patient comes on admission. Yeah, the very time that the doctor or the physician taking care of the patient is convinced that this patient needs admission or needs to be detained at the ward, we start the nursing care plan. That very moment we start the nursing care plan. And then once we started the nursing care plan, we also plan ahead to the termination of care. Okay, so we start at the very moment the patient is admitted, and then we continue it until the patient is the care is terminated, or the patient is discharged, or the patient sadly dies or something. And as it has been started, it is not kept a constant. Okay, it is not maintained that way throughout the patient's admission or the patient's care, but then it is gradually and consistently, continuously updated. Okay, so today the problem that we take care of today may not be the same problem that we take care of tomorrow, or the care that we put into today might not be the same as the care that we put into tomorrow. And that is all based on how the patient responds to the changes in the health condition. So if the patient is sick today and he comes and he is immobile, or let's say the patient is unconscious, the care for today or the nursing care plan that will be implemented or planned for today will be different from tomorrow if the patient wakes up from the coma or the being unconscious. So maybe today the patient is weak, he cannot do a lot of things for himself, he cannot bath, he cannot brush, all will be included in the nursing care plan. But if tomorrow the patient is a little bit active and he can bath on his own, he can brush his teeth, the nursing care plan is a little bit amended, so that we end up focusing on other risky problems. So if patient couldn't bath yesterday, maybe we did bed bathing for the patient, and today the patient can bath with assistance. We amend it, and then we make the plan bathing with assistance. And if the patient can bath all by himself, then we just take that one out as goal met or goal achieved. Then we move on to other problems that are still existing, or other risks that are still potential. Okay, so the nursing care plan is continually amended, continually updated. Things are taken out, things are added, things are implemented. Goals that are partially met are again planned ahead, like that. Okay, so it's not a constant that if patient has a headache today, the headache will be maintained throughout the nursing care plan. No, as time goes on, as days goes on, if the headache subsides or the headache goes completely, we take it out of our problems, and then we focus on other immediate problems. That's how the nursing care plan is. And then once we understand that there are going to be changes, then it means that we should always be flexible to the changes. Okay, so we should not focus only on the fact that the patient came with a headache. So every day we just continue with, let's say, self-prescribed medications. No. For example, if patient came on the ward with a headache and pain rating was on a scale of 0 to 10, let's say 8 or 9, you're not expecting that after 3 days the pain rating should still remain at 8 or 9. If that is what is happening, then it means your goal is not being achieved. Okay, but then after 2 or 3 days, we are expecting that the patient's headache or the problem, the rating should reduce. So from 8 to 9, we are going to get, let's say, 3 or 4. And if we are getting 3 or 4, then it means that the medication, the time that we're giving the medication, and then even the dosage of the medication is capable of being reduced, or even if necessary, medication must be stopped, and doctors do it. Sometimes they take out some medications, they change some medications and all that. That's basically because as the patient is still undergoing the care, they realize that changes have to be made. Maybe the medication is not helping, then they have to increase the dosage, or they just have to switch to a different generation of medication. And if we realize that the problem is subsided or the problem is dealt with completely, then we just stop that medication or we stop that treatment. So always make sure that you read through the plan, okay, because most of the time that's where the changes are made. If you need to stop the medication, they indicate it there. If you need to change some medications, they indicate it there. So you just have to go through the plan and then get to know all these changes so that the patient's care, okay, will be a successful one. Alright, so the nursing care plan, basically it forms as the basis for excellence in nursing practice. Because if we don't have a nursing care plan, you're not going to know all these changes. We are not going to be able to read our care and then know all those changes that are coming in. Okay, so the nursing care plan basically forms the basis, the very basis for excellence in nursing practice. So if your nursing care plan is not good, there's a problem somewhere. You're going to really affect the care of patients. All right, if you focus on problems that do not matter, you might end up actually killing the patient because you rather focus on unimportant problems while the actual risky problems are there. Okay, so that is the importance of the nursing care plan. Now we have types of the nursing care plan. Yes, we always have types of everything. The types, there are two basic types or two basic forms of the nursing care plan. We have the informal care plan and then we have the formal care plan. With the informal care plan, we are talking about the strategy of action that the nurse has in mind. Okay, so you see a patient and something comes into your mind. What do I want to do this for this patient? What do I have to do for this patient? What should I do next? What should I do before this? What should I do? That one is in your head. That is what you have planned for the patient. So that one remains in your head and it is informal. Okay, it is informal. And if we have informal, then obviously you know that the opposite is going to be formal. So we also have the formal care plan. The formal is just the opposite of the informal. With that one, you put your plans, your strategy, your actions and everything on paper or in a computerized form. So it's basically you documenting. So if it's not documented, it is informal. And once you put that on paper, you organize them and then you're actually using that as information in the care of the patient, it becomes formal. And under the formal, we have two basic types. We have the standardized care plan and then we have the individualized care plan. So understanding it, the standardized is, a specified nursing care for a group of people or group of clients with everyday needs. So they will bath, they will brush their teeth, that is personal hygiene. They will eat, that is feeding, and all that. They are basic needs that every patient needs or every client needs. So those are standardized care plans that we do for a group of patients. So for example, let's say all hypertensive clients, they need diets. They need a dash diet, that's diet without lots of salt and all that. So we have that care plan for that group of people. If they are diabetics, we have a care plan for that group of people. If they are severe clients that are unconscious, we know that we have to do bed bath for them. So we make that as a standardized care plan for them. But within that group of people, let's say the severe people, that we are going to have people that need specific care plans or specific needs that have to be addressed. And that forms the other section under the formal care plan. And that section is the individualized care plan. So with the individualized care plan, we focus on problems or needs of the patient or client that are very unique to them. So for that one, if I have a problem, you might not have that same problem. So it's an individualized care plan that they are doing for me. I have my unique problems. We are all severe clients, all right? But then I have my unique problem that needs to be taken care of. And you also have a unique problem. So with that one, it is a individualized care plan. So it focuses on the client's needs that are not met under the standardized care plan. All right, so that is how it is. We have types of the nursing care plan. We have informal, which exists in the nurse's mind, and when the nurse puts it on paper, it becomes formal. And another formal, that is the one documented or put on paper, we have standardized care plan, which focuses on addressing specific general needs of a group of clients. And then when an individual client has an individual problem or a specific unique problem that needs to be dealt with, that becomes an individualized care plan. Okay, so basically that's the types of care plan that we have. The next thing that we're going to look at is the objectives of the care plan. Yes, the nursing care plan has objectives. What do we want to achieve? What is the goal? Why are we even doing a care plan for a patient? Why don't we just take care of them as they come? We just give them para, we give them whatever that they need, and then they go. But then we are documenting or we are making a plan of care for them. Now the objectives or the goals for which we as nurses make the care plan is 1, we want to have an evidence-based nursing care for the patient. Now, what do we mean by evidence-based nursing care? We just want to be sure that we have something backing what we are doing. Something that shows that I actually did this for the patient. I gave the patient paracetamol. What shows that I did? The nursing care plan shows it. Okay, give this patient, let's say, haloperidol. Why should I give the patient haloperidol? The nursing care plan says so. Okay, so it gives us an evidence for all that we are doing. And then also it helps us to render familiar conditions in the hospital or the health facility that the patient comes to. So if a patient comes to the hospital and we know that the patient is a severe patient, then we just try to, as much as possible, plan the care in such a way that it fits with the patient's daily routine. So the patient wakes up early, the patient does this and that and that. We know this, we know from the patient history or the patient says it. So we try to plan our care in a way that it suits the patient's daily routine. All right, so that the patient can also be willing to tolerate the nursing care or, involve him or herself in the nursing care. And then the second one, the nursing care plan also helps with holistic care of the patient. When we talk about holistic, we're talking about involving all the major various aspects of the human person. So the spiritual, the physical, the psychological, the emotional, the social. Yes, the nursing care plan focuses on all that. And so it gives a holistic care to the patient. If the patient wants the pastor to pray for the patient, the nursing care plan shows it. So we invite the pastor to come and pray for the patient. If the patient needs spiritual, encounters with people, or the patient needs psychological encounter with a psychologist, the patient needs family around that's social, the patient needs to be alone, that is emotional, the patient needs physical care. The nursing care plan focuses on all that and not just only the physical care. So the nursing care plan helps us in giving or rendering holistic care to the patient. And then in that, it helps in the management and then the prevention of the disease. So we use holistic care to manage the patient's condition and then also to prevent a condition. Because most of the time, the patients that come to the ward, and for example, those diagnosed with chronic conditions like HPT, like diabetes, you try to, as much as possible, make plans for them that they can go home and go with, okay, that they might follow. If you don't make it in such a way that it suits their daily routine or their environment or their holistic care, their spiritual, their psychological, they're going to end up not following what you give them. If you come to, let's take Ghana for example, that we are very spiritual. If the pastor says they should do this and you say a different thing and you don't amend it or make it in such a way that it addresses their spiritual side, they'll throw yours away and follow their pastor. Are you getting it? So the nursing care plan focuses on all that and gives a holistic care in managing and then preventing conditions or exacerbation of conditions. And then the third one, we have the care programs. So the nursing care plan also focuses on using care programs or applying care programs in dealing with patient condition. And some of these care programs are the care pathway and then the care bundle. Now the care pathway is just a teamwork to come to a consensus. So it's like a path or a journey that we are all following as a team to come to a specific point or an agreement about the condition. So that's the care pathway. The care pathway focuses on all of us coming to a particular consensus at the end. So we all generate a path, we go on that path, and we come to an agreement at the end. That is the general consensus. And the care bundle focuses on all the best practices that we can give to the patient with regard to a very specific condition or disease. So if a patient has malaria, the care bundle focuses on all the care that we can give in order to take good care of the patient when it comes to he or she having malaria. If the patient has HPT, we focus on that, giving the best practice to deal with the HPT. If the patient has diabetes, we focus on all the best practices that we can put in place to deal with the diabetes. That is basically the care bundle. And then the next one is it helps us to identify and then distinguish the goals and then the expected outcomes. So that is what the nursing care plan does. It helps us, the nurses, in order to know what the problems are, know what the goals are, and then what we are expecting to come out of the goals. So the nursing care plan divides all these into categories. So we can get the problem, and then once we have the problem, we get to distinguish it from a goal. So if we have a goal, then what are we expecting to come out of it? That is how the nursing care plan helps. So you know all your specifics or all the groups that you want to have at the end of the care. And then again, it helps in review. It helps in reviewing communication and then documentation. Yes, if a patient comes when I'm on duty and I leave duty, which I will because I will stay throughout, the next person or the next nurse that comes after me is supposed to know what I have done for the patient and what is supposed to be done for the patient. The nursing care plan gives all that information. So the next person that comes to meet a different patient on the ward can just go through the nursing care plan and know that this is all that we've done for the patient so far. This is what he came with. This is how things are going. And this is what's supposed to be done as time goes on. That is basically how the nursing care plan also helps in the communication and then documentation. And the last one, it also measures nursing care. Yes, that is our let's say our criteria for measuring the care that we give to the patient. Was the goals achieved? If yes, then yes, we've achieved our goal. Are the problems what is actually existing? If yes, then we know what we are doing. So without a nursing care plan, we are just going to do random care for the patients, and you might end up focusing on unimportant problems or risks or potential issues, whilst putting aside the immediate problem that we should take care of. So the nursing care plan makes sure that it gives us that range, okay? It gives us that range that we should measure our care with, that we don't go beyond it or go less than it. That is basically the nursing care plan. Now for the next one, let's go to the purposes of the nursing care plan. Yes, the purposes. Why do we even have to do a nursing care plan? Well, the first one is it defines the nurse's role. Okay, so the nursing care plan defines the role of you as a nurse. That is basically what distinguishes you from the other healthcare team. So if we come and this is what we are doing, then we know that this is what the nurses are doing. So it helps in identifying the nurse's role in the general the health being of the patient, aside the doctor or the physician's orders. Okay, so we don't have to always rely on what the physician says to know what we are doing. But then the nursing care plan also allows us to, with our autonomy, do things for the patient aside or without relying on the doctor's orders. Again, it also helps us, that is the second point, it helps us in providing direction for individualized care of the client. So with the nursing care plan, we are able to, as we understood from the types, we have the individualized care plan, which focuses on the specific or unique needs of the patient. So it provides the direction for that individualized care of the patient. So we know what is wrong with the client, and so we tailor the client's care plan according to his or her problems, and not as a general or the standardized care plan. All right. And then the third point is it helps in the continuity of care. Yes, that is what I explained. If I'm not on the ward and I come on the ward maybe 3 days after my leave to encounter a different patient or a new patient, I will understand that this is what has been done for the patient. This is what the patient came in with. This is how the patient has been so far. And this is what is expected to be done for the patient just by going through the nursing care plan. So it helps with the continuity of care. And then it also helps with documentation. Yes, that is also one part of the nursing care plan. For example, if we come to the ward and you tell us that, oh, you've done this and that for the patient, and there is no nursing care plan, what shows that you did it? Nothing shows it. So we can't actually confirm whether you did it or you didn't do it. So the nursing care plan is the one that is going to help you in being able to show that you actually done something for the patient. And that is when you document everything that you do in the nursing care plan. The next point is that it serves as a guide for assigning a specific staff to a specific client. Yes, basically in Ghana here, it doesn't work that way. One nurse takes care of everybody. The nurses take care of everybody. So we don't have assigning specific patients to specific nurses. But then even in Ghana, even we don't do it. But then when you come on the ward, we don't give some conditions to junior staff or students. All right, we don't give some conditions to them because we realize that those conditions are beyond their knowledge. All right, so yes, even though it's not fully practiced here, then still even here we know that some conditions are way above some people's level, so we don't give them those conditions, but then we give those conditions to people that have the knowledge of it. All right, so it helps us in tailoring or assigning the clients to the staff nurses. And then the last one, it serves as a guide for reimbursement. That's the last but one. It serves as a guide for reimbursement. Yes, if an insurance company wants to know whether you were actually admitted to the hospital and then pay your insurance and all that, they need a nursing care plan. That is what's going to show that indeed you came on the ward, you came with this, you came with that, you came on this day, we did this and that for you, you left this day and all that. All right. And even if it doesn't go well, that is what will show that you actually came on the ward and you've died or something. So it helps as a guide for reimbursement. All right, nobody is going to cheat an insurance company or dupe an insurance company without, if there is a nursing care plan. Okay, so they just go to the hospital, they check the nursing care plan. If it is there that indeed you came on the ward, then they pay you. If it's not there, then it means you're lying. All right, and then the last one is that it defines the client goals. Yes, that's what we want to do for the clients. So at the end of the day, what are we expecting? All right, so our goal is maybe to make sure that the patient can breathe well, or maybe to make sure that the patient can walk well. That is the goal for the client. So it defines the client's goals. All right, it defines the client goals, and then it helps with the nurses to know what we are doing for the client. That is basically the purposes of the nursing care plan. Our time is fast spent, so we're going to end here today. And then the next time we meet, we're going to start with the components. We started the components under the nursing diagnosis, but then here we're going to basically focus on the components of the nursing care. What goes into the nursing care plan? That is what we're going to treat on our next video. All right. So thanks for joining me today. I hope you learned something. I hope something has gotten to your head. I hope you filled your head with something. Thank you, and then have a nice day. Have a nice life. Keep learning and don't forget to stay safe. Bye bye.